We designed a phase 1 trial to evaluate low doses of oral azacitidine in combination with R-CHOP in people with high risk, IPI 2 or above, diffuse large B-cell lymphoma. Overall, we enrolled 33 patients to the dose expansion, 33 patients to the dose escalation phase of the trial, 59 patients in total. And we have presented here at ASH the data from the first 33 people in the dose escalation phase. They were treated with 100 milligrams, 150 milligrams, 200 or 300 milligrams of oral azacitidine. The majority of them really treated with 200 and 300 milligrams. Every patient received 7 days of CC486 prior to the first cycle of R-CHOP and 14 days of CC486 prior to cycles 2 through 6. And all patients received G-CSF on day 2 of each cycle of R-CHOP. We found that overall we could deliver the treatment as we planned. The majority of patients didn't require dose modifications. Only one person was not able to receive all 6 cycles of CC486, and only one patient didn't receive all 6 cycles of R-CHOP. Overall, the treatment was pretty well tolerated. We had expected actually to find some nausea and vomiting. And I think because we had designed the study to try to prevent that by giving oral antiemetics, we actually were pretty effective there. We did find that there was some myelosuppression, so there was a 70% rate of grade 3-4 neutropenia, and 24% of patients had grade 3 or 4 febrile neutropenia. Nonetheless, overall it was a pretty well tolerated regimen, and it turns out it was pretty effective. 97% of patients had a response, and 85% of patients had a complete response. 4 patients had a partial response. Really, 2 of those we later learned were a complete response. So in total, about 90% of patients had a complete response. And these are not 90% of all diffuse large B-cell lymphoma patients. These are 90% of higher risk diffuse large B-cell lymphoma patients. So overall, pretty promising efficacy, we think. Obviously, when you're doing a study like this, it's nice to have additional data that tells you you're on the right track. And so we did that through correlative science. Leandra Cerchietti at Cornell headed the correlative studies from the whole trial. We received plasma samples pre and post cycle 1 azacitidine. Additionally, at Cornell, we did some tumor biopsies prior to the start of azacitidine and after 1 week of azacitidine before starting R-CHOP. And the Cerchietti lab found that indeed exposure to the CC486 resulted in hypomethylation genome-wide, and also in very specific genes that we think are responsible for chemotherapy resistance. And not only were those genes hypomethylated following exposure to CC486, they were also re-expressed. So the drug did exactly what we wanted it to do and what we had expected it to do. Additionally, we found in the plasma samples that there was an increase in secretion of interferon lambda, suggesting that we think that there's an antiviral response that's being induced by it. So there's actually an immune response that's being induced by CC486 that may help also to kill some of the resistant tumor cells.